Hi everyone, I'm Dr. Priscilla and I'm an optometrist. So a very common question I get asked is what's the difference between an optical dispenser or optician, an orthoptist, an optometrist, and an ophthalmologist? So the 4 O's of the eye profession. And so today I'll answer that. And because I live in Australia, I'm mainly going to be focusing on what these professions do here in this country. First, we've got an optical dispenser or an optician. And they're generally the first person that you see when you enter optical practice. What they do is they help fit you with glasses, contact lenses, or optical devices that have been prescribed by an optometrist or an ophthalmologist. They may have either undergone a certificate in optical dispensing or they may have learned the trade on the job. They show you different designs of frame and lenses to suit your needs, and they also take the appropriate measurements required in order to make up the glasses. And once your glasses are done, they will adjust your glasses and frames to make sure that they don't slip and slide on you. So optical dispensers do not treat or diagnose any eye diseases. A qualified or experienced dispenser understands things like optics, so how light works and how it interacts with different materials. And this is so that they can actually help to decide which lens material is best for you. So this is especially important if you have a more complex prescription, such as things like prism in your glasses, or if you have a high prescription and wanting to have a multifocal lens design. So understanding the science and technology behind it will make all the difference to make sure that when you get the glasses, it'll be visually comfortable. An orthoptist is a healthcare professional that has either gone through a 4-year undergraduate degree or a 2-year master's program. Traditionally, they were responsible for rehabilitating patients with eye movement disorders, such as strabismus, which is an eye turn, double vision, or amblyopia, which is more commonly known as a lazy eye. And they generally do this with a vision rehabilitation program. They have now expanded to doing pre and post-operative care and also screening tests for ophthalmologists. They're also trained in using technology to detect and also measure the progression of eye diseases, but they don't diagnose and treat these. You'll generally find orthoptists working alongside ophthalmologists in hospitals or private practices, and occasionally you may also find them in low vision clinics or even research. So an optometrist is an eye doctor that has either done a 3 to 5 year undergraduate degree or they've done an undergraduate degree followed on by a 4-year postgraduate program. They have the ability to do the things that orthoptists do, as well as doing vision testing to check your glasses and contact lens prescription. And they can also screen and diagnose eye diseases such as glaucoma, cataracts, and macular degeneration, as well as treating some of these eye conditions with topical medications, provided they're therapeutically endorsed. So optometrist is pretty much like a GP for your eyes. So we know a lot about your eyes and can manage a lot of eye conditions, but for more complex cases, we will refer to an ophthalmologist. So just like how a GP will refer to a specialist that has knowledge in a particular area. And there are also subspecialties in optometry that can include low vision, specialty contact lenses, pediatrics, or neurooptometry, just to name a few. An ophthalmologist is at the top of all the 4 O's. The common misconception people have is that they think that an ophthalmologist is an optometrist that has completed further studies. So that's not the case. An ophthalmologist has completed a medical degree first to become a doctor, and then afterwards they can further specialize in the eyes and complete a residency in the field. So it takes over 10 years to become an ophthalmologist. So that's why they're called the eye specialist. And so if you think that being an eye specialist is specialized enough, there's actually further subspecialties that include cornea diseases, retinal diseases, pediatrics, neuro-ophthalmology, or glaucoma, just to name a few. So ophthalmologists can diagnose and treat eye diseases with medication or surgical measures. And their patients are generally referred to by their GP or optometrist. Due to their extensive training, ophthalmologists tend to deal with more complicated, rare, or advanced cases. An ophthalmologist may work in the hospital or private practice, doing teaching or research. As you can see, all professions have their own individual specialty and they work very closely together to get the best outcome for your eyes. If you ever experience any vision or eye related problems, first point of contact would be to see your optometrist because they can check your vision and also do an ocular health check, and then they can either treat you or triage you appropriately to an ophthalmologist or another health professional if required. Hopefully this video has cleared up any confusion about what these eye professionals do. If you enjoyed this video, hit the like button, and if you have any other questions, leave a comment down below and we'll get back to you as soon as we can. Thank you for watching everyone. We'll see you next time.